Hey everyone, Dr. Tom Cheney here from Living Health Integrated Medicine in Annapolis. In today's video, I want to answer one of the most frequently asked questions that I get from my type 2 diabetics, and that question is, can diabetes really be reversed? And a lot of patients come in very skeptical because they ask me, Dr. Cheney, you're talking about reversing type 2 diabetes and you talk about your patients and all the great results that they're getting. Then why isn't my doctor teaching me how to reverse my type 2 diabetes? And that's a really good question, and that's a reason why a lot of patients come into my practice very skeptical that we're getting these results. So I want to answer this question, and it really comes down to the type of care that we're offering in our practice. So most of the patients that come see us, they're coming from the conventional medical model. The conventional medical model, if you look at one of my other videos, I talk about the standard of care in the conventional medical model, and that's where most patients are coming from. And they're coming from that model, which is, it's a very cookie-cutter model, and it's a very step 1, step 2, step 3. In our model of care, it's a functional medicine model, and the question that I ask over and over again is, why does this person have high sugars? Why are they a type 2 diabetic? That's what we want to get down to the root of and really correct it. But back to my original question, can this be reversed? And I don't want you to take my opinion. I don't want you to take my, my patient's opinion of having it be able to be reversed. I want to talk about research real quick. So there's research out there, and a lot of what we do, most of what we do is supported by research that's out there, but you're not going to hear about this research. So I want to share it with you. And these are just 2 studies that I want to share with you today. This one, the first one is out of JAMA, the Journal of the American Medical Association. It was published in 2012, and the title is Association of Intensive Lifestyle Intervention with Remission of Type 2 Diabetes. So JAMA is talking about the remission of type 2 diabetes with an intensive lifestyle intervention. So that's what we do in our practice. It's very lifestyle based, and it's really focused on correcting the root causes of the problem. See, what we see is many diabetics, by the time they get into my office, there's a lot of dysfunction in the body. There's organs, glands, and systems that are dysfunctional. So what we want to go after is getting those areas functioning and getting them healthier. And so we do it through functional medicine. So I'm going to share one more study with you. This one is from 2011, and the title is Reversal of Type 2 Diabetes. So it's talking about normalization of beta cell function. Beta cell function, the beta cells produce insulin from the pancreas, and it's showing that abnormalities underlying type 2 diabetes are reversible. So they've done some, once again, they've done some changes in lifestyle and showed that when they looked and applied that to a certain group, they were able to normalize blood glucose levels, thereby reversing type 2 diabetes. So, like I said, I don't want you to take my opinion. I don't want you to take my patient's opinions. I want you to look at the research, and the research is supporting this model of care. Once again, this model is a functional medicine model that looks at reversing the diabetes by addressing the root cause. So I hope you got some great information. If you have some additional questions about reversing type 2 diabetes, then check out my seminar, diabetesreversalseminar.com. You can register for an upcoming seminar there, or you can call 888-514-4771, and I look forward to seeing you soon.